So first, 80% of people have some distortion of the nasal septum. So how do you know if you need to have yours fixed? Well, to put it simply, if you have symptoms. Now, the most common symptom of a deviated septum is nasal congestion, but then there's also nosebleeds, headaches, postnasal drip, and you might breathe loud or snore while sleeping. Now, before considering any procedural fixes for the deviated septum, we try a whole host of medical treatments. We usually try nasal sprays, sinus rinses, and nasal saline, and those can all be very helpful. And most nasal sprays aren't addictive, and you can use them for long periods of time, like Flonase and Nasonex. Only sprays like Afrin, oxymetazoline, and neosynephrine are addictive. And if these medical treatments haven't solved the problem, then it's time to start considering having your septum fixed. Now, surgery for a deviated septum is called septoplasty, and it's done under general anesthesia on an outpatient basis. All of the incisions are hidden inside the nose, and there are no external signs that you've had anything done. There's no swelling, bruising, or changing of the shape of the nose. And typically it doesn't hurt much. It's just uncomfortable, like you have a bad cold for the first week or two. And there's lots of crusting that needs to be cleaned, so you'll have regular visits with your surgeon to have that done. And that usually stops by 5 to 6 weeks. Now, if you don't have any symptoms but want the outside of your nose fixed, you should still have your septum fixed. And that's because anytime you change the shape of the nose, you have the potential to affect breathing. So fixing the functional parts of the nose is just as important as fixing the cosmetic aspects. Additionally, if you're having your septum and rhinoplasty done, you should have them done at the same time, because that'll affect the extent of the septoplasty that we can do during surgery. Grafting for rhinoplasty also typically comes from the septum, so you want to have the rhinoplasty and septoplasty done at the same time, otherwise that septal cartilage is discarded after it's sent to the pathologist.